Good afternoon. Thank you for joining us. We're going to begin in about 1 minute to allow for some late logins. Good afternoon. Thank you so much for joining the webinar. Today, we're going to discuss community engagement and planning and ongoing support for community responder programs. Next slide, please. So we're first going to begin by providing some information on community responder programs, an upcoming community responder toolkit that's in development, and methods of engagement. Then we're going to hear from one of our speakers from the Albuquerque Community Safety Department. She'll give an overview of some of the work from ACS, as well as talk about their work to develop a community responder program and how they've truly done cooperative engagement with the community in development of the program. Then we'll hear from our next speaker from Policing Alternatives and Diversion, or PAD initiative in Atlanta. They will speak about how they have worked to engage the community in their process of developing a community responder program. A big portion of this discussion is actually going to be questions and answers. So there will be an ongoing discussion about community member input and how that has been used to help plan, implement, and how to continue to engage the community once your program is implemented. We're also going to have interactive questions and answers, so we really hope that you came with ideas and questions in mind, because we're looking forward to hearing from you all. So our speakers today, so we have Moki Macias, who has served as the Executive Director of the Atlanta-based Policing Alternatives and Diversion Initiative, or PAD, since its launch in 2017. PAD reduces arrest and incarceration for activities related to mental health, substance use, and extreme poverty through two strategies: law enforcement assisted diversion for individuals detained by police, and alternative response teams that accepts referrals through the City of Atlanta's 311 line. Moki received her master's degree in city and regional planning from Georgia Institute of Technology and has spent over 15 years engaged in community organizing, engagement, and advocacy related to criminal justice reform and community development. You can learn more about PAD at their website, which is atlantapad.org. Our next speaker is Mariella Louise Angel. She is a Chicana, born and raised on the border city of El Paso, Texas. She understands the needs of diverse communities and works to empower, educate, and advocate for all Burqueños. Prior to her appointment as the Director of Albuquerque Community Safety, or ACS, she was the City Coordinator for the Office of Immigrant and Refugee Affairs. In her new role, leading the third branch of public safety, they're working to ensure that the department follows through on its mission of advocating and promoting citywide culture that values voices of all residents. She brings to the City of Albuquerque an extensive background in education, business development, and corporate customer relations. She holds a master's degree in business administration and human resources and a master's in social work and leadership and administration. And lastly, I'm Sarah Wurzberg. I'm a program director within the Behavioral Health Division at the Council of State Governments Justice Center. I'm a social worker by training, and I oversee training and technical assistance for diversion and reentry programs across the country. I also am working to lead our development of the Community Responder Toolkit, and I oversee our substance use disorder work at this agency. So just to start with some brief logistics. So if you have any questions as we begin talking or as the webinar is going, there's a chat box in the lower right-hand corner of the screen, and I would encourage you to put any of the questions that you have as they come up in that chat box. We will be having a lot of this be discussion oriented, so feel free to chat those in at any time. We're also going to be using a Jamboard link that has been included in the chat. Next slide, please. For those of you who are not familiar with Jamboard, it's a collaborative online whiteboard, and it gives us the opportunity to have a more real interaction with the participants of this webinar. You can add sticky notes, which answers the different questions that are available on that link. We have 3 questions. One is, what are some lessons learned about community engagement and community responder programs in public safety? Another question is, what successes would you like to share or hear on community responses program? And then the third question is, what resources do you need to support the implementation of your community responder programs? So we're viewing this as a way for us to learn more from all the participants and have a bit of a dialogue with you as we go in this session. So just to begin with, we wanted to define a bit of what community responder programs are. So community responder programs are led by civilian or community responders who have specialized training and background to help people in crisis through wellness checks, violence prevention and intervention strategies, connections to services, and other non-law enforcement responses. When establishing community responder programs, jurisdictions need to identify the types of calls that would be responded to and what are most appropriate for community responders. So my colleague has put up some polling questions in the lower right-hand corner. So we'd really appreciate if you could answer those polling questions so we get a better sense for who's tuned into this webinar today. The first question is, does your community have a community responder program? And there's 3 answers. One is yes, and it is implemented. The other one is not yet, but it is in the planning stage. And then the third is no. The next question that we're asking you to answer is just to get a sense for where everyone's located. So we put some of the regions in the country in that list. So if you just select so we can figure out where everyone's from, that would be most helpful. And then the third question is actually, what type of agency do we work for? So in order to develop these types of programs, you really need a strong multidisciplinary team to be engaged. So we want to know if you work for state or local government, if you're one of the providers for health or housing, if you might work for a police department, fire, emergency medical services, or grassroots organization. So if you can just select the polling questions in the lower right-hand corner, we would appreciate it. We just want to know who we're talking to so we can better tailor the information. And just as a reminder, in the chat box, my colleague also has posted the Jamboards. So after you answer the polling questions, if you could please look at those as well. So we'll just give it about another minute if you can respond to the polling questions. We just want to know if you have an active program, where you're located, and the type of agency that you're coming from today. So we'll give it about another 30 seconds on the polling question, and then we'll close it so we can have the results. Okay, so for the first question, which was, does your area have a community responder program? About 20% said, yes, you do. 17% said, not yet, but we're in the planning stage. And 23% said no. There's also some of you who didn't have the chance to answer this. When we're looking at the regions, it looks like the top region represented was the Northeast, followed by the Southeast. Then after that, we have a tie between the West and the Midwest, and then the South. When it comes to who is actually on the line and what agencies are representing, the city and local governments are the most represented here. We have followed by state governments, and then police departments and grassroots organizations, and then behavioral health providers. So we really want to thank everyone for joining, and thank you for letting us know a little bit more about you and what you might be interested in talking about today. Next slide, please. So the organization I work for is a nonpartisan, nonprofit organization. We're a membership association serving all three branches of government. And then within the Justice Center, we have policy and research expertise to develop strategies to increase public safety and strengthen communities. So how do we do that? So we bring people together through national convenings, through webinars and things like this, just to share what's going on in the country and some innovative programming. We work on original resource, things like the 50-state report on public safety. We try to build momentum for policy change, both at the state and local level. And we provide training and technical assistance to a variety of sites through federal and foundation funding. Next slide, please. Our goals are to break the cycle of incarceration, to improve health, opportunity, and equity, and to expand what works to improve public safety. So today, as I mentioned, I'll start with the next session, which is I'll give a brief overview of community responder programs to level set, talk a bit about a toolkit that's in development and methods of community engagement before we go to our two excellent speakers who have developed these programs in their communities. Okay, so let's talk a little bit more about community responder programs. So community responder programs have really represented an opportunity for different jurisdictions to rethink public safety and reimagine what the community thinks about in terms of that. So really thinking through for a crisis, how do you ensure public safety and sustaining safe and vibrant communities in a way that matches what the communities want and the communities need. So with the expansion of these programs rapidly over the past year or so, we have received funding from Vital Strategies to develop a toolkit, which is really going to be a one-stop shop for some information that gives basic information on how to develop, plan, and implement these programs. And it's going to have great resources, including a link to this video, to really share information from sites around the country and what they found through their process of planning and implementing these programs. Next slide. So community responder programs can be broadly broken down into three categories. So there's community responder programs who are run by nonprofit agencies. So an example of this is Cahoots in Eugene, Oregon, which is a healthcare provider, a Whitebird Clinic, which is running this one. There is examples of other nonprofit agencies run in New Haven, Connecticut. One of our speakers from PAD in Atlanta is an example of a nonprofit agency who's supporting this work. There's also examples of violence prevention and intervention groups, such as Newark Community Street Team, who's overseeing these types of programs. Then there's a subset of community responder programs that are run by an existing government agency. So it could be the police department. That's an example of that's in Olympia, Washington. It could be a fire or emergency medical services department. They are doing that in Portland, Oregon, and fire and public health are working together in San Francisco for that program. Then there's also this other example, which is community responder programs that are through a new local agency on community safety. So we're going to hear an example from that from Albuquerque today, and Ithaca, New York is also planning to develop this type of agency. Next slide, please. So the toolkit we're working on, we're hoping to provide some information in some key categories that sites will need to think through to plan and implement these programs. So a part of this is the community engagement and stakeholders. So that's broadly the focus of this today. So there will be resources and links to information and surveys that different sites have done on this. Needs assessment and asset mapping. So how do you know what's available in your community and how one of these programs could help fit within the community infrastructure and enhance what's already going on? Thinking about the call triage processes, so how are these calls routed? Is it through 911 call centers? Is it through dispatch? Is it through police radios? Is it through 311, 211, alternative crisis lines? There's a lot of great options out there. Thinking through the staffing, so these programs are usually between 2 to 4 people, and it varies. They might be someone with lived experience in the justice system. It could be a peer. It could be social workers. It could be harm reduction case managers. It could be community paramedics. It could be community health workers. So there's a lot of different designs and models that we're seeing out there on staffing. There's going to be some information on data collection and quality assurance and some links to some studies that have already been done on some of the programs. We're going to talk about safety protocols and wellness. So what are some of the questions related to safety of going on site, as well as wellness of staff as first responders? There will also be information on financing and sustainability. So how do you get funding for these? And what are some state and local legislative strategies or examples of what's been done at the state and local level to move these programs forward? Next slide, please. So these processes have really been community driven, and it's important to recognize the power and voice of the people who live in the community that's served to make sure that residents are involved in the decision-making processes and that people who are most harmed by the jurisdiction's responses to crisis or interactions with the criminal legal system really have a strong voice within this, and really to ensure that Black, Indigenous, and people of color in their communities are able to lead the efforts to reimagine public safety. So it's really important to think about how to provide information and really have an interactive dialogue as you're developing these. So different jurisdictions have done this different ways, and we'll talk a little bit about some of the forms of community engagement on the next slide. Okay, so one of the community engagement frameworks you could use would be to inform. So thinking about how to educate communities and rationale on the information of the project and how it can respond to community needs. So thinking about different outreach options. You can consult, so really how to ask and advise community members to better inform the work of the project. Collaborate, or collaborative engagement, which would be to create partnerships to work with community members alongside the jurisdictions in developing, planning, and implementation, to really think about shared decision making. So how can you delegate decision making power to community members or provide a formal role in the final decision making processes? Some of the methods that have been used by different sites, and we hear a lot more from Albuquerque and Atlanta in just a minute here, is to develop stakeholder groups with that decision-making power, to conduct focus groups or discussions with the communities that are most impacted, and to do surveys of key stakeholders, which could include community members, law enforcement, 911 call triage or dispatch leadership, things along those lines. Next slide, please. So now I'm going to pass it off to Mariella, who's going to give us some information on the Albuquerque Community Safety Department.
Hi, everybody, and I think good afternoon for you guys. I think it's mid-afternoon for Albuquerque. My name is Mariella Ruiz-Angel. I'm the director for the new Community Safety Department in Albuquerque, and I'll be telling you a little bit about what the program is and how it came to fruition. But a big piece, which I love, and why I'm in government and why I work for government, which I know many of you guys probably feel the same, is because of the work and the people that you get to work with and the communities that we get to serve. And so I think this presentation and just this entire webinar around community engagement was really exciting. So thank you guys for having me today. Next slide. So the Community Safety Department is a cabinet level department. It was launched in June of 2020. After the murder of George Floyd, the city of Albuquerque, who was also on a consent decree with the Department of Justice, had already been, prior to that, been talking about alternative responses. And although we had lots of really successful pilots, it just wasn't really what our city needed in regards to the size, nor the actual model and the culture that we were trying to develop. And so Mayor Keller at that time decided that we really just needed to jump in with both feet and just create an actual department versus trying to really force it into an already pre-existing department like the police department or a behavioral health department. So this new cabinet level department will be going out to 911 calls that will have to do with inebriation, homelessness, addiction, and just the array of mental health and behavioral health type of calls that we get. In addition to responding to 911 calls, we'll also be going out, we'll actually be doing our own outreach and doing follow-up on a lot of calls that sometimes we just never know what we did something that actually had good outcomes. So we'd like to be able to collect that data. We've started our process of hiring our first responders. So these are folks that have backgrounds in social work. Myself, I'm a trained social worker. We've been bringing on people that have backgrounds in working with those who are experiencing homelessness, folks that have good knowledge in the courts and diversion programs, peer support specialists, and promotoras, community workers. Next slide. Ultimately, ACS really wanted to try to be, we want to align with 911 and our current safety, public safety departments, but we also knew that we needed to be different. And we also needed to figure out what makes us different and what was the whole purpose for actually doing something so bold and big. Because starting a new department, if anyone's ever done it, is extremely costly and extremely time consuming. And so we needed to make sure that we had some goals. And again, these were our first goals, and they continue to stay true, but some of this has changed as our mission and vision has developed. But really the goals were to send the right resource to 911 calls, right? When there's not a response, when there's not a need for a badge or a gun or an EMT or firefighter, it leaves us with very little options sometimes. And so we know that there's a way for us to be able to get into some of those calls and really help, whether it be preventative or even the after a traumatic 911 call. Additionally, the goal was to also reduce footprint of policing in communities that are already highly policed, and as well as decriminalizing mental and behavioral health issues and illnesses. So, it isn't always about mental and behavioral health, and it has a lot of underlying issues. Let's not, when you look at 911 calls. However, some of this is like, yesterday we saw a person who called and was sitting waiting for a police response to go out to a car that was just the alarm kept going off. And unfortunately, police officers are so, in Albuquerque at least, are at capacity. And so it took 5 hours to get somebody out to that situation when we knew that, one, it was already a neighborhood where we didn't really need to send police out to, and two, we could have, as a responder, as somebody who could have really gone out and checked in, made sure that there was nothing suspicious happening. We could have gone out to that within an hour or even less. And then lastly, really, we have such an amazing broad spectrum of social services in the city, and yet we really struggle to make the connectivity to other types of entities like our county and our state and all the amazing nonprofits that we work with. And so part of ACS is to hopefully be a catalyst and to streamline some of those processes that right now aren't as seamless as they can be. Next slide. So we started with, as many of you guys, as you're thinking about these programs, we started with a really intense community input and engagement process. So, from a government perspective, right, we did our big announcement from a press release and press conference, that really kind of got the chatter going. And then we started that in mid-June, and that pretty much went all the way until October, in which we met with folks across the entire city. And so we, small meetings, making sure people understood what we were trying to achieve, where it was going, how long it would take, what kind of input we wanted. It included youth and it included all of our commissions and boards. It was a very, we did some town halls and those were fantastic, but there was nothing that could replace those very much more kind of intimate meetings where people then felt like they had a voice. During that entire process, we collected as much data. We don't always do that with community meetings. We just show up and we kind of listen and sometimes, give input or give a presentation. But it was really important for us to make sure that we noted what kind of presentation we give, who we talk to, and who were at those meetings. And then we decided to kind of launch out a perception survey shortly after that. Those types of meetings happened. We wanted to see if people were understanding what we were trying to achieve, if it was still needed, like would we still have, right now that things had kind of come a little bit down from the unrest that around George Floyd and others who were murdered that summer. We really wanted to see, like, are people still feeling this? And so we ended up having really great results on our perception survey. And we had some bad ones too, where it was also a critical time, right? Defund the police movement was very big at that moment. And so we did get a lot of negative pieces as well. But for the most part, the perception survey went really well. So we spent a good chunk of time doing that. And then go to the next slide, please. And then what we made sure to spend a lot of time mapping that out. A lot of times administrations, and for us, depending on where you're at, whether it's an election year or whether you're, really community wants you out there sooner or whatever the agenda might be, we had to make sure that we set really good expectations for our administration. Sometimes that's not, in their agenda and they say, get it done, move it faster. But we knew that we were like, okay, our timeline needs to be XYZ. And we explained why that was so important, and then what that time would look like. And so we spent a lot of time setting good expectations with our administration, letting them know that this would be around, right, making sure that we had good prep, good street outreach. Not everybody had access to internet, as we know during COVID-19, that was extremely highlighted. Making sure that we had good social media, that TV outlets were talking about it. We had our trusted messengers, which was probably one of our biggest pieces, was we were able to get across to many more people through those folks. And then of course, language access, depending on what part of the country. Sometimes, right, there's communities who won't have access unless you spend time on translation and interpretation. So we made sure to spend time on getting that developed as well. And then of course, using other media outlets. Next slide. And so as we approached, we decided that we wanted to have a couple weeks of what normally would be, again, in a perfect world where we weren't in a pandemic, we would have spent a lot of time putting together some sort of like weekend gathering where we would have had lots of facilitators and whiteboards and, really, breakfast or lunch or something really great for community. And unfortunately, we didn't have that. We didn't have that possibility. It wasn't possible for us with COVID. And so but we know we couldn't wait for that to happen either. So we went with our Zoom and all these really amazing WebEx that really still was challenging, but actually worked out really well. So the first thing we decided to do when we decided that we were going to do facilitations was finding the right facilitators. I will say, as I've been doing this work now aligned with other police and firefighters, what we found is that there are some community that will not respond to certain types of folks. And so having a room full of police officers was not going to be a good fit for us when it came to facilitations. And so we actually ended up going a much more community-centered approach and trying to find folks that were from community and also from our Office of Equity and Inclusion. So most of our facilitators really had already done a lot of work around implicit bias and anti-racism training, and really had done time, and we're also trainers in being able to do that work too. So that we centered the work around the injustices around race and around inequities that were happening during that time. So that was really important, is to find those folks, and again, then finding ways to then create your facilitation around some of those really great facilitators. So we created times that were not business hours, as much as, a lot of us are paid to come to these facilitations. They're not really great for community. So we had to find times that worked for those individuals. And so that would vary different, mornings, afternoons, and evenings, and including weekends. And then we had to invite the right people. All of the folks that we got, right, we ended up having a lot of really amazing people who wanted to participate, but they weren't our audience that we were trying to achieve. So, right, you might end up having a lot of your community policing councils and a lot of your boards and commissions, and those are fantastic, and we want them there. But we also needed people who are impacted by the system, who are impacted by the inequities, who are marginalized on a day-to-day basis, and so and who have the struggles of mental and behavioral health. So we ended up having to figure out, how do we get these folks here? We had incentivization with small stipends, and we were flexible around going to them and their locations. And then we set really strong guidelines. So again, during some of these, it can be, sometimes people come with different agendas, and they're going to find a way to try to make it that agenda. And so we had to be very clear on what we were trying to achieve here, and that this was not a conversation about the police. This was a conversation about an alternative to policing. And so I think, again, having really facilitators and having good guidelines up front, even before the day of, we sent out multiple emails and multiple YouTube videos of folks talking about what to expect on the day of your facilitation, because that also weeded out a lot of people who were going to come and try to create, other types of agendas than the one that we were trying to achieve. So that helped really set kind of the tone and the culture for what we were trying to achieve for those facilitations. And then we used really great tools like Mito, which is like a whiteboarding tool. So when people talked, it was great because we could really show what that looked like. And then people were able to take those thoughts and kind of work off of those, similar to the Jamboard. So as we get to those and we're working through that, we found it to be really helpful for people, especially when you're in a 2-hour type of facilitation. It could be a lot, especially when you're on Zoom. So we wanted to have something that was visual and engaging. And then we just had to, again, we had to think out of the box. Not everybody wanted to come to a city government meeting. They just weren't comfortable with it. And so we asked nonprofits and different organizers to see if they would host something at their location, or host something that they felt right, and then only invited certain people to be a part of those facilitations. Right, we've had experience with our transgender resource centers and DV and people who have experienced domestic violence, who really wanted to have something very separate. And so so that really worked well. And then we didn't force it. So as much as, I have a picture of our facilitation, one of our pieces of our facilitation, and sometimes none of those vibed with people, and we just had to kind of go with what people really wanted to talk about at that moment. Now, it's not to say that they would get off too far, but as long as we were centered around alternative responses and what they wanted to see, we let the conversation happen, because there was a lot of hurt and there was a lot of trauma that was experienced last summer, and then in the midst of a pandemic. And sometimes people needed to vent and to heal and to have those conversations in a place that felt safe. So we did not try to force some sort of agenda and some sort of like, it has to be this way and we have to get this out of it. So next slide. So just really quickly, part of, again, the survey question, and this really was a perception survey, and this was kind of midway. But right, we really took what we found through our facilitations And what we found through our surveys was that they were very aligned. And that was really helpful for us because it has the now taking it so that we know what we should be prioritizing. So here, one of our top ones was, right, people experiencing homelessness, needle pickups was a big one, welfare checks, suicide threats and attempts, and then general behavioral health. Interesting though, as we've been going through this process, though, we've seen some of the ones that are in blue become an option for people. And it's been very interesting to kind of see how people's comfortable, are a little bit more comfortable with the idea of saying, well, actually, I would love to have an officer, but then I would love to have somebody who I can talk to afterwards, just so I can have a safety plan, or just so I can have an understanding on what to do next. So yeah, so this has been, maybe we'll do something down the road where we can do another perception survey, but this was really helpful for us. Next slide. So after all of that, after all the engagement we did, we spent a couple months trying to finalize a community engagement report. And this was really important for us, as you know, is that people will ask a year later, well, I never got to put input, or I didn't get to have a say, or and so we wanted to make sure that people knew we did get a chance to talk to as many people as we could, and then what came out of that. What types of themes came out of those conversations? Who did we talk to? How was that recorded? It was extremely important for us to have that because, as much as we wanted to continue, and we did in the community engagement process, when you're developing something new, you also need to move. And so a lot of times when I've had to make decisions on, do we do this or do we do this, I can refer back to our engagement report and the voices of our community and say, this is what I've heard, and this is probably what they're going to prefer. And so the engagement report was helpful for lots of reasons. And so that was, but again, it was like for our internal ability to understand and stay on track. And then again, also for community to understand what we heard from them and did that make sense. And so we put this actually out before it was fully published to a lot of our participants to kind of say, is this correct? Did we capture everything right? So that was something we felt that was helpful for us. Next slide. So as we got going as we finished up the engagement events, we realized that we really wanted to start up a steering committee. Or a planning committee. And so we ended up asking a lot of folks who were involved from the very beginning, along with our county, our state representatives that have, around behavioral health to be a part of that. And so this was just a snap of our membership. We actually just made a decision yesterday as a group to expand this. So we will hopefully make this into much more of a formal board or commission in which we'll be able to then have this open to public and hopefully be able to have a larger network of individuals that are involved in ACS. Next slide. So just so that you know a little bit more about our program, so I've talked a lot about the engagement process of this, but I want you to know where we ended up. So the city of Albuquerque, again, decided to go department-wise. So with myself, and we report to our chief of administration, our administration officer, and then it kind of falls into two different categories. So we've got our internal policy and administration division, and then we've got our field response division. We ended up deciding that we didn't need just one type of responder. We wanted to have multiple types of responders. A lot of our behavioral health folks that we know and are wanting to do this work are fantastic, and we wanted to pay them what they deserved. But in some cases, when we have individuals in the evening time, which we do get a lot of welfare checks for people who have, decided to, they've had too much to drink and they end up, sleeping it off at a bus stop. We wanted to make sure we had another responder who could go out and check on these folks and make sure that, one, we could either get them home, or two, we could get them to services or a sobering bed. And so that doesn't necessarily require that same kind of behavioral and social work type of work, right? So we have decided to kind of create a different type of group that will help us with some of like things like abandoned vehicles, right? Abandoned vehicles is one of our #1 calls that we get at the city. And it doesn't require a badge and it doesn't require a gun. Now we won't enforce abandoned vehicles being towed, but we wanted to make sure people knew, like, if we could help people get their cars to their location or connect them with services, that's what we're hoping to do. Additionally, if you've been in that world, abandoned vehicles is also one that we find where there's tends to be people sleeping out of their car, especially with COVID-19. And so we wanted to make sure that we could address those issues right away and not have them wait or then create more issues for them by giving them some sort of citation. So, so those are types of calls that we'll be having different folks go out to. And then, of course, we have our behavioral health. And then we do have a co-response model. It's our mobile crisis team. It's been a model that's been used for the last few years here in Albuquerque and been very successful. And that's a police response with a clinician. And so we hubbed that under our department because the clinicians really needed a place where they can feel at home and where they could be supported. And so we brought those folks in. And then lastly, one of our responders is a homeless encampment outreach person. So this is a person that goes out before police are sent out or before there's an enforcement piece of this where they are then forced to move. So yeah, lots of really great stuff. If you want to go to the next slide, I think I give a little bit more description. Yeah, so the other piece of this is we also are really trying to make sure that what we're doing here is in a trauma-informed way and that we're not creating more trauma. So a lot of the calls that we're trying to go to are low acuity, you know, not a situation that would have any sort of major safety issues. However, we are training on all of those aspects just in case we ever hit a situation where we have to tactically retreat. But if you've ever had a chance to talk to the Cahoots, you know, folks, who have been doing this for many, many years, I think they say that maybe they get 1 or 2 incidents a year where there's a safety concern. So we've taken some of their pieces of their model and tried to incorporate that as well. So if we can go on to the next slide. So luckily, Albuquerque has had a really great, successful year with our fiscal year. This year, we were given 7.7 or appointed $7.73 million. So by the end of FY22, our hope is to have an additional 61 positions on top of the 24 that we already have now. And then hopefully with data and hopefully with support from community and folks, I think that we'll be in a place where our administration would like to see this department be anywhere between 200 to 400 individuals out on the street. So we're very excited about that. Next slide. Lastly, I added this. I won't get too much into this because I know I think I maybe hit my time, but I wanted you guys to have this, and I don't know if these will be places for these to be shared. But Sarah, I definitely wanted folks to have kind of a little bit of more of a description of our timeline as we approach kind of implementation from the last year. And we have much more detailed stuff. So if anyone's interested or wants more information from Albuquerque, we're happy to share our documents. But as you can see, we're in April, May, we just finished. So if you can go to the next slide, we are in June, July, where we're testing all of our dispatch, testing our 311 process, our transport process. And so we will be ready to roll in August. So we're very excited about that. And then the next few, probably until December, we'll pretty much be just really watching and understanding data as we want to try to create more capacity and understanding for this department. But, you know, as you know, 7.73 from our $213 million that went to the police department is a very small amount. And, you know, when we're talking about police responses or fire responses, the #1 issue and why the budgets are so high is because of personnel. And that's what we're finding as ACS is launching, is that if we're going to ask people to come in and be a different type of an alternative, right, a new type of responder, we have to pay that equitably, we have to equalize, right? How do we give people the same incentives that we do for police and firefighters, who then end up, right, don't mind working those extra evening shifts, that don't mind working holidays or weekends. So as you're thinking, just as thoughts on, if you're thinking about this type of model, thinking about how you either, right, are able to pay that additional piece, or how other ways that you can incentivize. Right now, we're working through, and I probably shouldn't say it fully, but we're working through our class and comp to try to classify some of these positions so that we can give some sort of safety to folks. Now, we're not fully unionizing them, but we're definitely trying to figure out, how do we make sure that we're meeting the need, right? Because there is going to be a need of these new types of responders nationwide, social workers, counselors, people jumping into this. How do we meet that need, so that we can start creating pipelines of individuals coming into these new positions? And so that, hiring is a big deal, and how we pay is a big deal. So anyways, I think this might be my last slide, but we can go to that final one. So thank you guys so much, and I'm happy to answer questions. I think we might be doing some at the end, but thank you so much for listening, and happy to answer anything further outside this meeting.
Thank you so much, Mariella. And yes, if anyone has questions, please put them in the chat. We've received a couple already. After we hear from our other speaker, we're going to go into discussion mode. So please feel free to look at the Jamboard or ask your questions in the chat box. So next up, we have Moki Macias, who's going to talk about Policing Alternatives and Diversion Initiative in Atlanta. Take it away, Moki.
Thank you. Good afternoon. It's a pleasure to be here, and I really appreciated hearing from Mariella on what Albuquerque is doing. It's really inspiring. So I'm here today on behalf of my team at the Policing Alternatives and Diversion Initiative, more affectionately known as PAD. And I appreciate the opportunity to share a little bit with y'all about how we develop. I'd like to just acknowledge it does feel somewhat difficult to have this conversation without the insight of Black leadership, which really, who has really been driving this sea change in our country. So I want to just acknowledge the wisdom and the leadership and courage of Black community leaders across this country, and organizers that have been really creating the conditions for the kind of innovations that people are standing up around the country. So we can go to my first slide. Thank you. So the Policing Alternatives and Diversion Initiative came out of a campaign actually led by Solutions Not Punishment, or known as SNAPCO, in 2013. It was a grassroots coalition, mostly led by Black and Brown, queer and trans folks, that were really focused on trying to reduce the type of criminalization and targeting for police enforcement that Black trans women were experiencing in certain parts of the city of Atlanta. And out of that effort came the idea of connecting people immediately to resources instead of arresting and booking individuals who were committing survival activities, who had already been marginalized from the existing social service systems, and who were doing what they needed to do to survive, right? And so we started out as a diversion program operating on the LEAD model. So law enforcement assisted diversion came out of King County in Seattle, but has now been a model that's been taken up across the country as a way to not only immediately provide an alternative to arrest when folks are detained by police, but then also to connect people to long-term support and navigation to address the barriers that keep people in a cycle of arrest. So, building off of that work, I think has set PAD in a unique position for two reasons. One is that we came out of a community organizing process, right? So there was sort of a clear connection to local criminal justice reform work from the very start that we have worked very hard to maintain so that we remain in alignment. And then the other reason is because we had a foundation of already having responders go out to the streets, right? Our teams, some of whom are pictured here, our teams would go out and meet officers and then start working with people right away. So we've had that foundation of a few years of doing community response, although it was in a law enforcement assisted diversion context. So I just want to mention that. Our goal is explicitly to reduce arrest and incarceration for folks that are experiencing challenges related to substance use, unmet mental health needs, or extreme poverty. But we know that in order to do that, we are a pathway, we are not the solution, right? So we need to increase the accessibility of the kinds of supports and, the kind of resources that people need, that we have as a society sort of been hiding folks in our jails instead of actually dedicating resources to what people actually need. So we know that that is an important piece of alternate response, is also ensuring that we are investing more in the kind of public infrastructure, public services, and opportunities for housing, income, and healthcare that we know are necessary. At the same time, we recognize that in order for an alternative response to be effective, we're going to need to take community concerns seriously and actually have responses to those concerns. Next slide, please. Thanks. So our strategies are to, like I shared, provide an immediate alternative to arrest. But what I'll really focus on today is what we rolled out beginning of this year, in January 2021. So in addition to providing that response to officers when they make a diversion referral, we now respond to community concerns through our City of Atlanta 311 line. So the line that folks usually use to find out when their municipal court date is, or to report a pothole, or to request some other city service, can now be used to request consent-based outreach from one of our harm reduction teams. And those are some of my colleagues there as our referral coordinator who actually accepts those calls, and then 2 members of one of our harm reduction teams who actually responds to the calls. And then our work is to connect people to the services that they need and to provide the care navigation, legal navigation, and emergency housing often supports that folks need. Not everybody, people are coming in with different needs, right? But about 95% of the people that we work with are experiencing homelessness. And that is one direct benefit and resource that we can offer, that we have been very clear that makes a big difference when we can offer a service like a hotel stay as a respite stay, and then connection to our housing partners within our continuum of care. It really does. It creates a different opportunity for somebody who may have been choosing to live on the street because they can't use the options that are available. Next slide, please. So I want to talk just a little bit about how we designed the PAD 311 community referral response. So as we developed, initially we did a lot. We had a large design team. We did a lot of community engagement. We did a lot of data analysis when we first started. So we learned from those lessons to be able to really to design our expansion in the summer of last year. So with the organizing and mobilizing that was happening last summer around the murder of George Floyd and death by police killings of other Black folks in and around the country, including in Atlanta, there was a very clear public call, right, for non-police responses. And as a result, a direct result of that organizing and that clear public call for alternatives to police response, the City of Atlanta invested in our expansion citywide. And so we really kicked off, once we received that investment from the city, we kicked off a 6-month process to figure out what that would look like and how we would partner with an existing public line that was not 911 in order to start recruiting some of those non-emergency calls out of the 911 emergency system and into what we felt was a more appropriate public system. So that was sort of our approach. We did a few things. I'm going to talk about each of these in subsequent slides. So I'm going to start with, we pulled together members of organizations and communities that we had already been working with over the years, and that had raised this concern, over the years, wanting a different number to call, wanting to access PAD services without having to rely on a police referral, right? So we pulled folks together. We had we had 6 different working groups with about 40 community members and public officials in those working groups to really invite people into the process to say, we need to figure out the protocol. We need to figure out, the nitty gritty of what's eligible for these types of calls. What is the response? When and how would we involve police if there was a need to? What are we doing in terms of follow-up with community members? So we really started with developing these working groups to just invite folks in to say, help us work through what the big questions are and give us feedback as we design the protocol. So that was really the bedrock of what we did. And then we brought in a lot of data through the survey, the call for service analysis, and the listening sessions. Next slide, please. So for us, an important data set was the 911 calls for service. Our system receives about 1 million phone calls per year. And we wanted to get a better sense of what those calls were about, right? The work of Rebecca Newstetter out of the University of Chicago Health Equity Lab is, I think, really powerful work. I'll drop a resource in the chat. But the work that she has done and colleagues really speaks to the fact that the vast majority of calls coming into 911 are not actually related to like imminent physical danger, and often are related to the calls that do not need a law enforcement response, right? 911 has sort of defaulted to a police response, and we see that from the calls coming in that is actually really not necessary. And so we wanted to see what that looked like for us at a local level. We identified almost 20% of that data set, about 600,000 calls, that we felt could be potentially appropriate for diversion or deflection. And part of the challenge with call data is that it's very broad categories, right? And then there's not a feedback loop for when officers then go out and identify what is actually happening. There's not a feedback loop to kind of correct that in the data. So you have these large codes like suspicious person or person screaming that really don't provide a lot of accuracy. But that said, we took a look at the calls that we had, and a couple things stood out to us. One was that 41% of these calls were received to the police non-emergency line. And we've seen that actually is fairly common in places around the country, that the non-emergency, like 7-digit number, is actually just rerouted straight into the 911 dispatch number. And so, for us, it was an important clue that, if 41% of these calls actually resulted from somebody picking up the phone, dialing the 7-digit number, and then getting 911, it was clear that people were looking for a different option because they didn't necessarily feel that it was a 911 emergency call. The other thing that we noticed out of this data set, which was striking, was that the vast majority of these calls were assigned either a 20-minute or a 50-minute response time, which is basically 50 minutes is like, it's the longest response time the dispatcher can assign in our system. And so, again, sort of indication that many of these calls were not what we would perhaps think of as an emergency response, right? Not what people imagine when they imagine somebody calling 911. So that was really useful information for us to start really drilling down to, what are the dynamics now of those calls to 911, and where can we start recruiting some of those calls away from an emergency system into a more appropriate system. Next slide, please. So, similar to what Mariella referred to, we did also sort of a community perception survey. And the goal for that was, on one level, to just raise awareness that this was something we were thinking about, talking about, and wanting people involved in, right? So, just kind of getting the word out there through this survey was a useful tool for us. But the other thing was to demonstrate that there was public will. We already knew, right, from the number of people coming out in the street, right, from the 8 hours of public comment at our public safety committee meetings, right, we knew there was clear public will for alternatives, but having another resource to kind of point to say, there's public will here, and we want to partner to figure out how to respond to it, right? So we asked folks, what would be their likelihood to refer our harm reduction teams through 311 instead of calling 911. And we saw, I think, what is fairly similar to what many of you may see in your own communities, that there are a lot of activities that people are surviving. They are doing what they need to do because there's a lack of public investment in public infrastructure like bathrooms or housing, as well as there's an over-criminalization of the kinds of just survival activities, right? So people are doing what they need to do, and then the recourse has been to involve police for enforcement action. I want to note one item on this, which is asking for money on the street. We saw very few people saying they would be likely to refer to 311. What we learned in the comments was that for the most part, respondents were saying, well, I wouldn't call 911 for that, and I wouldn't call 311 either. Like, that is not actually something that warrants a response that another person is asking you for, if you can spare $1, right? Which I think in of itself is important information, given that the city of Atlanta, which like many cities around the country, still does criminalize panhandling as an arrestable offense, which would lead up to 6 months of jail time. Next slide, please. So the other piece of this work was to do community listening sessions. And for us, a critical piece was to co-host our sessions with a broad group of convening organizations. And so, it's particular to Atlanta, of course, but just to call out, we had, business associations co-host with us. We had our local chapter of the Movement for Black Lives. We had service provider organizations. We had faith-based organizations. And advocacy organizations. So we really tried to co-host so that we could invite the community in that was maybe connected to one of our co-hosting organizations to have those conversations with us. And really the purpose of those conversations were to be able to engage with people on the sticky questions, right? So the questions of like, what is the protocol if police do arrive on the scene? Well, our team is responding. When would we, involve police? What would we do if police were involved? These kind of questions. What kinds of concerns feel appropriate? What feels like it is more appropriate for a de-escalation focused team, which our team is not necessarily, specific for de-escalating or mediation, right? So we were able to really just sort of put it out there. And I think that's one of the lessons for us is like, I think we can't show up saying we have the answers because we are building this new approach together and we're learning as we go. So to show up with the questions, I think really invites people into figuring out like we're gonna be learning together and we're gonna have to make adjustments as we go. Next slide, please. So I want to just kind of show you where we landed. We ended up basically identifying these activities as appropriate for a referral through 311. And I just want to note most of the activities here can be probably described in terms that would be associated with a either city ordinance violation or a state misdemeanor charge. And so, it was important for us to not continue criminalizing particular activities with the language we're using, but also to continue making that connection, right? That we are not asking community members to just go out there and call us, every time they see somebody who is sleeping on the sidewalk, even though it is, not something I hope, anybody is ever desensitized to. But what we're really looking for people to do is to call PAD through 311 when there's an issue that they need assistance with directly, and that if it were not resolved, likely they or someone else would be calling for police intervention. And so, a good example of that would be, the small business owner where, they're coming into the, to open their business every day, and there's a person who has defecated all over the front of their store, their shop window, right? And this has happened repeatedly. Then, these are real calls that we get. Something that is not tenable for the business owner, and also it is clear that the individual needs assistance and is not going to be served by a police interaction or jail. So there's a balance there of trying to just really educate and invite community members into conversations about what is appropriate for requesting a response to, and what is some of our own needing to change our perspective on how we show up as neighbors and just engaging with community members as neighbors instead of asking for an external response. Next slide, please. So this is how the 311 system actually sort of gets the calls to us. I just want to mention that 311 as a public call center is able to reroute to 911 if need be. They do it often for any kind of requests coming in, and they also can receive calls from 911. We've worked closely with them on what would be appropriate here when somebody calls for assistance from PAD. And so, medical emergencies tend to be the thing, right? If somebody is passed out on a bench, they're not moving, that would need to be rerouted to 911 for EMS support. They also reroute resource requests to 211. They reroute to our mobile crisis line and peer alarm lines, and then they send us responses that require require an in-person response. For most responses, we will respond within 30 minutes. Our average time is now 14 minutes, but we also do designate outreach requests. So, if somebody is in the area, has been there for a while, if we can kind of coordinate with the community members who are calling, we'll do that. Next slide. So yeah, I think I'll basically end here. What I want to say here is that community responder programs can't be a different widget, right? You can't just take out the police widget, pop in the community responder widget, and then expect that we will do the same thing, but in a nicer way, right? We are not showing up to remove people, and we are not showing up to institutionalize people. And that's something that is an ongoing conversation with community members to help people reorient their expectations. That, when we show up, it is a consent-based outreach. And it means that we are going to work with the person, and we are going to respect if they decline to engage with us, but we'll be persistent, we'll be creative, we'll offer resources, and we'll offer just basic, respect and kindness. And that is not, that is not the way we have been taught to approach a lot of these concerns communities, right? And so we need to really just change what our expectations are when community responders are called. And then the last slide, I think there's a few, oh, I think we missed the last slide. Okay, that's fine. That's it for me. Thanks.
Thank you so much. And so we're going to move to discussion. So just a reminder to everyone that there's a chat box at the lower right-hand corner. You can please chat in any questions you have for the speakers. We've already gotten some. There's also a link to a Jamboard, which has you sharing some information about your efforts, and also the opportunity to provide information on what else you would like to know about. So we're going to move to more of a facilitated discussion and get some of your questions answered. So please keep them coming too. Okay, so just to begin with our discussion, I will ask, we can start with Mariella, but of course this is gonna go to both of you. But how did the community help advocate for the development of your community responder program?
Well, I think that it wasn't just like a one side, right? It wasn't just one thing. I think there was, right, and I think, Moki, you said it best early on, right? We had already been in situations, at least in Albuquerque, and then we knew nationwide, where this had been an issue. We had been on our consent decree with the Department of Justice for almost 8 years. And things are not getting better here in Albuquerque, and we were still seeing issues with excessive force, and we had seen situations in which people with mental and behavioral health issues were just like, there was just not enough for them. So with all of that said, this wasn't just like an immediate, right? This wasn't just like it happened and all of a sudden all these people came out and it was outspoken. We did have unrest here, but it wasn't as bad as I've seen other stuff and other unrest, and especially what we saw across the nation. So that was one piece, but the political push was really about you know, the mayor has being held for safety issues and because crime is so high in Albuquerque. And so we were already really organized here in Albuquerque. Community was already extremely organized to be able to, right, when George Floyd happened, man, it just really jumped into gear. And so there was no like real need. I think the mayor had already had the voices of community at the front line because we've surrounded ourselves, and that is a community thing. That was the strategy, right? When this mayor came in, we kept community at a very nearby link so that we could at any point understand what is the pulse, what's happening out in the community, what are we doing? And then he surrounded himself, right? We hired community members to be inside city government. So myself and others who are part of communities and coalitions and organizations already had a very clear understanding what was coming down the pipeline. And some of that we could share, and some of it we weren't going to, because that was, right, we needed to stay true to our community as well. So I think there's some strategy from a community perspective as we think about how you're integrating into city government and how you're working with your political leaders. But then again, how your administration's hiring and how you get a better pulse on your community. Before things could get bad, we already knew the mayor needed to do X, Y, Z so that we wouldn't necessarily have that same kind of unrest that we saw in other cities. And so we definitely made that push. So again, I don't think it was like this one size. It was more of like a progression that was coming and that we set ourselves up for early on when we voted this mayor in. Additionally, I think what has then continued is that we have a very strong stakeholder, right? Part of us creating the stakeholder group has also allowed us to understand where are we at in the community, and then where I can't push anymore. And this is going to be really helpful, I think, as we know that sometimes things don't jive with certain administrations, is I can only push to an extent, right? Directors are only there to be able to really be that messenger, but community can still push, right? They can really make the ask as they need to. And so having that political will and that community will consistently at all times and letting those things surface up as they need to organically, I think is really strong. So anyways, with all that said, I think ours was really like more of the long game from a community standpoint, and then we as community trusted messengers lifted those when it was time to do that. So I think we've just continued to do that as we've done this work so that we can continue to have that support, but then also making sure that we include community like in things like our training. We've opened up our new training for our new responders. We've asked our stakeholders to participate. It gives us a sense of trust, right? They feel like they're included and that they have say, and we're transparent with every piece of what we're trying to achieve here. So I think it's really a full like loop and really thinking about the long game.
Sarah, I can just speak to this real briefly because I think I touched on it in my presentation. But I think what has been really important for us is to stay in alignment with the local criminal justice reform movement here. So to ensure that what we are doing is not undermining, unintentionally, but still is not undermining what demands are at the local level. For example, just looking at the need for broader decriminalization efforts here in Atlanta, and the interest in that. We want to ensure that while we're creating alternative responses, we're also creating evidence for the ability to decriminalize many of these charges, for example, right? So I think that alignment, and we're able to do that more so because we are an independent agency outside of city government. But I do think to the extent that it is within, these efforts within city government, those opportunities, like Mariella said, of listening in on, really accepting any and all, feedback in any way people are willing to give it, but also to show up to other people's tables, right? To really hear what people are saying that they need, by not always expecting the people to come to you, but rather being willing to participate and show up when you're asked to show up, I think is really important.
Yeah, thank you both so much. So another piece of this that I'm curious to hear from you both is, do you have any tips for other sites on how to continue to keep community members up to date on your programs as you plan and actually implement these programs? How is there accountability to report back to the community for your efforts?
I think for Albuquerque, it's that stakeholder group, right? I think I'm broadening that out as much as we possibly can so that it really does include the folks that we know tend to be the loudest sometimes. And by loud, I mean, again, you get those same kind of neighborhood associations, and we appreciate that. But at the same time, it takes a little, sometimes it takes really being purposeful in who you're inviting to those community events to really understand that you really have to, in order to get the full array, you're really going to have to figure out a way to include people who don't normally get included in those, and then make that space safe for them as well. And so what that looks like and what that means is different for every city and every type of group. But we've had to be really specific on, right? Some folks are just not comfortable with officers in their meetings, and that's okay. They don't feel like they can share or feel like they're safe. And we've had to be very purposeful as to who we invite from the police departments and the fire departments so that they don't trigger community. So, it's things like that that we have to be conscientious of when you're creating stakeholder groups. And I'm sure you guys all know that. Additionally, for those other groups, because it is hard sometimes to manage a large stakeholder group unless you're like in a very public meeting type of style. We just, we go to some of these meetings, right, where MRACs across the, MRAC's the big one, and I'm sure if you've ever been under a consent decree, right, our mental behavioral health groups that are, through the consent decree, we show up to those meetings, we give updates, we stay included, and then we make sure that we have that the feedback loop, giving it time so that we then say, okay, let's revisit this and say, right, this is what we decided on before we make a final decision. How does this feel? So it gives people a time, also like a time frame, to then also be able to give input, where then instead of just showing up and being like, hey, what do you think about this policy? Read it right now and tell us, right? Because that tends to happen a lot in government. We show up and we're like, we have this really great thing. Can you make a decision right at this moment? Giving some time for that feedback and being real purposeful as to how you do that.
Yeah, I'll just note, one thing that we haven't brought up yet is talking to the folks that we are assuming may want our services or are sort of the recipient of our services. So I just want to note there, I think that piece is very important. For us in our planning efforts, we identified a few ways to do that. We conducted, in the beginning stages, we were conducting focus groups with folks, and we're very clear that we wanted to speak to community members who tend to be more to call the police, and we wanted to speak to community members who were policed. And so, worked with community-based researchers to build focus groups and to recruit to those focus groups to have conversations with people about what people's experience being policed has been, particularly folks that may be surviving on the street, who are sex workers, who are often not invited into conversations about what should look different, what should look and feel different. The other piece is, in developing, for example, we were doing some work on the idea of a diversion center, and just a resource center. We went out and surveyed and had conversations with hundreds of people in order to ask them, if you're living on the street right now, what would you need in a center like that? What would make you feel welcome? What resources do you need? What are your priorities? So I think that piece of it is really important, for us to be continuously engaging the folks that we're designing these programs for.
Thanks so much. And we have a lot of questions, so we're going to move to some of the questions from the participants on the webinar. So the first one is actually around how do your programs work with other deflection or pre-arrest diversion initiatives in the city? So maybe we can start with Moki for this one and move back to Mariella.
Sure. So we run a pre-arrest diversion program, a LEAD program here in Atlanta, and a big piece of that work is that we have the prosecutors, public defenders, and the police department all around the same table. That's sort of a key part of the LEAD model. That has been very helpful for us in that we are able to then help people navigate their legal barriers, and we're able to address any concerns that prosecutors may have as they are engaging with our participants in the court, whether for old cases that are still open or if people get rearrested. One thing that we did as we developed community referrals was basically we are able, if the individual that is referred through the community line through 311, if they have an open case in the jurisdictions that we're already partnered with, we're able to then refer them into LEAD, if they consent. And so that provides an opportunity that, even though it didn't come through a police diversion, the connection, it does provide an opportunity for us to work with the criminal justice stakeholders to try and address some of the legal barriers that people have when they're, because oftentimes, they do have open cases, or they do have police contact or get rearrested. So that has been a real benefit to us to be able to have that kind of open communication, because we already are also doing diversions.
Yeah, similarly, we've been using LEAD probably for the last 3 years now, and it didn't take off right away. I'll be really honest. Our officers, because of the way that it was initiated through our county, it didn't take off. Interesting enough, I think bringing in ACS has kind of relifted that. And so we've all kind of realigned ourselves so that we could have similarly be at the table to be able to understand, one, what works well and what doesn't work, and two, interesting enough, we're starting to see some of the diversion programs are fantastic, and then some of them are not. And I think that's been really helpful for us to be at the table where maybe nobody's really wanted to bring it up, or maybe it's been just too complicated. And so we've actually even been able to talk to some of the judges to be like, this is a clear barrier, and maybe the reason we're not able to get people in is because no one's ever going to qualify for that. So it allows us to really even be, again, I call it a catalyst, because we can't control all systems, but we can be a catalyst to hopefully having some, change in areas where we think it might open doors for others.
Thank you both so much. So this question I'm going to direct to Moki, and this person was wondering is, can grassroots organizations start and maintain this type of model, and will they qualify for funding?
I think that's such a good question. Thank you so much. I think that there is a continuum of other ways for us to respond to these kinds of concerns in our communities. And I really strongly believe that continuum has to include sort of institutional responses, which are, more public or publicly funded, and non-institutional responses, which are perhaps more of a mutual aid model. And so, I think there's room for all of it, right? We've gotten the question a lot about, why we would choose to partner with a public number instead of, have it be completely outside of the system and, be able to, for people to just call our direct number. And I think it is really critical that public resources, public infrastructure, public dollars, are directed into non-police responses. So I feel strongly that using the public infrastructure and reshaping it, for us, even 911, right? I mean, and I think Mariella's work in Albuquerque is such a good example that 911 does not have to default to police, right? And so, I think similarly in Atlanta, the fact that we are using a public system is really important and I think strategic. That said, I think there is a lot of just care that can happen in community and that people are already doing, right? It's not being funded. People are often doing it because they're just having to figure it out when a loved one is in crisis. I think many of us, we've all been there, right? And so I think thinking about the way we can direct resources and support to organizations, community-based organizations, and even just groups of neighbors, right? Who are doing this work or want to do this work, I think is really, really critical. I think it may be harder to get public dollars for that because there will be strings attached, right? But I think, in terms of the national philanthropic community, I think that is where we could really see, investment should be going into more mutual aid type of formations. And I think that is critical, right? Because so often you don't need somebody else to show up. What you need is to know how the systems work and how to navigate them, and just sometimes just like coaching and emotional support for providing care when folks are in crisis. So I think it's a huge and critical piece of work. I would recommend the Anti-Police Terror Project as an organization that is doing incredible work in that space, that is less institutionally based, as a place to check out. And I'll share that link.
Thank you so much. So this question is for Mariella, and it's actually on politicization of these types of effort. Was there any political opposition or efforts to try to politicize the reform, regardless of the original intentions of it in your community?
Yeah, we're still going through it. We're in the middle of an election with somebody who is running on like a super safety agenda. And so we are being looked at pretty heavily. Additionally, people could say that our police union is anti-ACS, but then, from a actual, like, what it feels like, it doesn't feel that way. Like, the news is stating that there's other pieces that are happening, but we're just not getting that from police officers. We're not feeling that impact from other types of from like our Bernalillo, our county partners or our state partners. We're just not getting that same kind of like pushback. It's actually been pretty peaceful considering all things, and the fact that our budget got the full amount that we asked for was appropriated to us, I think speaks millions. Now, I will say, can I anticipate that next year, depending on how this election goes this year for us, things might be different. It's going to be more costly for us to think about how we're going to support ACS going forward if we're planning to have more personnel and more people out on the streets. And I can give you one guess on where some of that funding might come from. So I think that that'll be a really interesting journey for us as we move forward past November. But yeah, we're just, there's a difference between like what's happening in the media and what's happening on a, behind the scenes compared to like the actual work that's happening internally. And I think we've had just an amazing response, and we've had community, again, having those trusted leaders, and especially even higher up, right? A lot of our city councilors, commissioners, we did that work early on to make sure that we had right, everybody felt really comfortable, Republican, Democrat, despite political stance. We had a lot of people who were like, yep, we really need this for our community and we're going to support it. So let's see how that journey, continues, but it is part of the territory, but I think it's definitely manageable.
Thank you so much. And there was actually a question on whether we think that these could be in other types of communities, such as rural and suburban, and I'll take the opportunity to answer that. So we have talked to non-urban jurisdictions who are actually doing these. We've identified about 50 sites around the country who are actively in planning or implementation stages for this. So absolutely, I think it's possible that you could implement in a different setting, and there would have to be thought based upon your local community on what the needs is and what that could look like. So I think there definitely are options. These are just happen to be two urban examples from different areas of the country for this session.
And Albuquerque is a really interesting place because we are still considered a big city, but we live like a small town. Like, that's Albuquerque. I don't know if anybody's ever been to Albuquerque, but like, we're very small. Everybody's just like one or two people extension away from each other as they know each other, but we are still a very large population. So culturally, we're set up, it's just an interesting dynamic. So yeah, I agree with Sarah, and Sarah's been great, and there's been connections all over. And interesting, I think we were one of the only cities that created a department, and we've now seen a couple more cities decided to do that. And I think it's a very bold step, because it can be costly, but at the end of the day, it allows you to really start a little bit from scratch, right? Start your own culture, start your own ability to really like, it allowed us to bring trust into our department, in which other community would never trust, other departments, because they've been existing for a very long time, and that's just so many bridges burnt. So it's actually turned out to be a really great thing for us.
Thank you so much. And so within the slide deck, the webinar and the slides will all be posted online. There's some additional resources that link to some of Albuquerque's and Pat and Atlanta's resources and surveys that they've conducted. We wanted to make sure that you're aware that our organization is partnering with Department of Justice to host an event called Taking the Call, which is going to be a national conference held October 20th to 21st. So we encourage you to sign up if you found this interesting and if you're interested in learning more. I just want to really thank our two amazing speakers for all their work and for their time to speak today. Thank you, Mariella, Louise, and Hal, and Moki Macias. I also want to thank Ashton Tolles and Eunice Kwok from my team for helping facilitate all of this. It takes a lot of people to get these things done. Would also like to thank our funder, Vital Strategies, in particular, Deanna King, and would also like to thank Jasmine Griggs from Radical Imagination Strategies. So thank you to everyone for attending today. We really appreciate it, and we look forward to continuing this conversation with you all. Have a great afternoon. Bye.